Good afternoon, everyone. It's my pleasure to join with Governor Christie and Health Commissioner Zucker from the state of New York and Chris Perino from the state of New Jersey, who is the counsel to Governor Christie. I'll make an opening statement. Governor Christie will make an opening statement. You'll then hear from Commissioner Zucker, and then we'll have any questions. Ebola is obviously a deadly serious situation. We all know that. The current case that's being handled at the Bellevue Hospital has been well handled, and the news thus far has been good news. I'm confident of the level of preparation that has been undertaken. Our equipment and training were in place, and we had the advantage that Mr. Spencer, who is the patient at Bellevue, is a doctor who was familiar with the disease and familiar with the symptoms. But this is not the time to take chances. For 4 years, I have erred on the side of caution whenever it has come to dealing with a crisis, and that has served the state well, and there's no time to change now. Our region is a dense region. A ride on a train can affect hundreds of people. Several weeks of normal activity can affect several thousand individuals. We believe it's appropriate to increase the current screening procedures for people coming from affected countries from the current CDC screening procedures. We believe it is in the state of New York and state of New Jersey's legal rights to control access to their borders. We will establish an interview and screening process to determine an individual's risk level by considering the geographic area of origin and the level of exposure to the virus. Depending on the risk level, a person could require mandatory 21-day quarantine or at a government-regulated facility. Low risk would be medically monitored for temperature and symptoms. Others will have a protocol developed to fit their particular circumstances. We have informed the CDC of our intention, and they agree that states have the right to establish their own guidelines. We are talking to the CDC, and they are reviewing the policy with regard to returning healthcare workers to see what additional protocol measures are needed. We will work with them because we believe the measures need to be strengthened. These new procedures have already been put in place at the Port Authority airports. I want to thank Governor Christie and his staff and his team for the expeditious work on this situation and for their spirit of partnership. This is an evolving situation. It's a situation where government must move quickly and rapidly. It's unfolding. The more facts you get, the more information you get, the more adjustments you need to make in your policy. And it's a situation that truly tests the capacity and the ability of government to perform. I'd also like to remind everyone that while this is a difficult situation, and Ebola is a frightening virus, there's no doubt, there's also no doubt that we have gone through many frightening situations, many difficult days. We've had many diseases that we've dealt with. We had fears about the SARS virus, the MERS virus, the H1N1 flu, the bird flu, HIV. When that was first heard of, it was petrifying to society because we didn't know enough about it. We worked our way through all of that. And there is no reason for undue concern or undue anxiety under this situation. We are very well prepared, very well trained, and things could not have been going better from a functional point of view to this date. I believe this adjustment and increasing the screening procedures is necessary. I think it reduces the risk to New Yorkers and to the residents of New Jersey, and I think public safety and public health have to be balanced, and I think this policy does that. With that, let me turn it over to Governor Chris Christie, and once again thank him for his partnership and all the good work that his team has been doing over the past couple of days.